A warm welcome here in Boston.
Good morning, everybody. It's an honor to be here. I got into the medical cannabis field because of a friend who was sick. My background is pediatric emergency medicine, which I did for about 13 years in the Los Angeles area. Busy hours, working at night, taking care of pretty sick kids in the inner city and East LA. And then I had a small child at home and I was burned out. And so I took time off, and at that time, we all say things happen for a reason. A friend of mine contacted me who was sick and said, I want to use medical cannabis, and I was utterly ignorant. I had no idea. I remember the college days, and after that I had no experience. So I decided to do my research, and I started reading, and because I had time on my hands, I was able to read a lot of the scientific literature, and I was blown away. And I said, I'll help you. And then when I decided to go back to practice, I decided to transition into the medical cannabis specialty, and that was in 2008. And I really haven't looked back since then. I take care of both adults and children, and because of my pediatric background, I, in the past 3 years, and again, part of that too because of Dr. Sanjay Gupta's documentary, have had an incredible surge of pediatric patients seeking care. Unfortunately, California has the reputation of the Wild West, and I would say that without regulations there, it is kind of hard to practice. But what I'm going to tell everybody is that my patients are getting medicine, my patients are getting better, my patients have better quality of life. And so the rest of the country, it is imperative that we follow, or the rest of the country follows California. We have a lot of things that we can do better there, and I think that we're working on it with the government's now stepped in a little bit to help regulate. I think people in the industry are starting to recognize that they have to self-regulate. I heard Dr. Meshulam say yesterday, medical and recreational need to be separated. Absolutely, 100%. They both need to be available in every state. In this great country of ours, we need to lead the way for the rest of the world, because this is a plant that has some incredible properties, and in a country where we allow people to drink alcohol and smoke cigarettes, I mean, really, we have to look at ourselves and say, what are we doing? So without further ado, I'll just move on here. I just decided to make a list of diagnoses of the patients that I see in my adult patients. This is just some of the more common diagnoses. As you can see, it spans just about everything. In one day's time, I can see patients with 10 different organ systems involved. And so, again, going back to the endocannabinoid system being involved in all of these illnesses, that's why it works. Even my own attorney says, oh, you think it cures everything. And I said, no, it doesn't, but you have to look at where the cannabinoid receptors are located. And that will help lead you to understand what's going on with these illnesses. With pediatrics, as you can see, it's just a handful of diagnoses. By far, it's the patients that I see with treatment-resistant epilepsy. I'm seeing a lot more patients with autism, and I think John did an excellent talk about how this is such a devastating disease for families. It really impacts the quality of life for everybody. Think about siblings who are living with this, who struggle to just go to school. They have a sibling at home that they're terrified of. This is something that definitely needs to be addressed. Advanced cancer in pediatrics, which is heartbreaking. And then I've been seeing a fair amount of patients with severe psychiatric disorders, and also PANDAS, which I'll go over. Only a few patients with that, but I've had very good success in just that handful of patients. The rationale for cannabis use in pediatrics is that over the past decade or so, with thanks to many of the researchers that are looking at endocannabinoid dysfunction, there is some scientific evidence showing that these patients are having manifestation of endocannabinoid dysfunction. If their endocannabinoid system is not working, we are seeing illness. Also with cannabis, if you look back throughout time, going back even to the mid-1800s, There are reports looking at the safety of cannabis. There was one that British researchers went to India to look at the safety, and it's a really interesting report from 1894. And then there's been multiple reports after that of the safety profile. This is safe. Of course, with children, I like medical supervision, but there's no question that cannabis in general is quite well tolerated and certainly safer than most of the medications that we're prescribing to children. Quality of life, of course, is very important. When you have a child who's ill, and the parents in the audience who have an ill child can tell you quality of life is terribly impacted. When it comes to some of the cancer patients or some of the patients with epilepsy who have terminal genetic disease, just compassionate care and end-of-life importance there. And there's no question that that helps people get through that. In California, of course, since 2012, we've been able to test the quality of products. Does it have a ways to go? Yes. And certainly after Kevin's talk, I've learned a lot more about testing for microbial organisms. But we do have the ability to test so that patients can be somewhat assured that the medication that they're getting is clean. And then, of course, research is still desperately needed. There's a lot of research coming out now. The fact that we're all here today looking at this is absolutely inspiring to me. I've met so many people who are interested and intrigued by this plant, and all of us need to really go out there and spread the word and lead the way. So what I did with my practice, since I don't have a lot of time today, I decided just to kind of collect my data. And so I looked at my patients who came to me with treatment-resistant epilepsy. They had to be on at least 3 months of oil, and some of them were even on oil a year or even 2 years, and it's a whole plant oil extract. And I was able to get results from 201 patients that responded to my emails. And the age range was 5 months to 18 years. And just people always ask me, how many patients do I have? I have over probably 300 plus pediatric patients using cannabis right now. And 200 responded to about 201 responded to the email. So average number of anti-epileptic drugs tried prior to coming to my office was 12, and there was a range of 2 drugs all the way up to 22. The average number of drugs that they were taking at the same time as they started CBD was 3, with a range of 0 to 7. There were 15 patients in this group who were not taking any other drugs at the same time that they started CBD, which definitely, in my experience, makes it easier because of the drug interactions. And then I listed the common comorbidities. I mean, these patients have a lot of challenges: global delay, CP, autism, cortical visual impairment, feeding difficulties, and so on. So it's not just one thing necessarily that we're looking at counting seizures. We're also looking at, are these other issues being improved by cannabis as well. And then the strains and the CBD to THC ratios varied. Charlotte's Web is a fairly common medicine for patients to use, and it's about a 27-to-1 CBD to THC ratio. And then various preparations of ACDC, which is available in California. And I will tell you that I've been doing this 8 years now. When I first started, nobody even talked about CBD, and really until about 2012, 2013 is when we started talking about it, and literally because of the push of families to get access to this medication, in the past year and a half, it went from 1 product available to now at least probably 10 or 12 products available for people to try that are clean and tested and in general so far fairly safe for my patients. And here I made a chart of the results that I've seen. So as you can see, some patients did have worsening seizures, and we like to attribute that to drug interaction, but 2 of these 8 kids actually were not on any medication. So there's no question that some of these patients do not do well with CBD. No response in this particular group was 6 And I do know that I have a higher number than that did not respond to my emails. So it's hard to say necessarily that that's the exact number. I do believe that it's a little bit higher than that. What's interesting is that I had about 28 patients that responded who reported that there was no reduction in number of seizures, but they had a reduction in the severity and the duration with cognitive improvement. And many of them report that, because the seizures aren't so bad, we don't have to go to the hospital as much. We're not using rescue medicine as much. And that, again, is an improvement. And remember, these are people who are living with seizures sometimes in dozens of seizures a day. Some even have hundreds of seizures a day, who are now saying we're having some improvement in the quality of life because we're not in the hospital every 4 weeks. And again, the disruption to family life when you're in the hospital all the time. And it's funny because one of my patients is actually doing quite well when the family came back for a recheck just recently. And I said, well, just, tell me negatives, positive, whatever. And the first thing the father said is, I don't have to take care of the kids because my wife is sitting in the hospital with the sick one. And so that was huge to him. That was the number one thing. And they have 5 kids. So it's very hard when one parent disappears for a week to go into the hospital. And then as you can see, the range are 25 to 49%. And again, this is based on parents. I asked them to keep a log, to keep a calendar. Some of them are very good at it. Obviously, it's hard to keep track of every seizure, but at the same time, we have to trust the families to be able to give us a legitimate number. I do find that the families, when it doesn't work, they share that with you. This is a costly medicine in California. It's out of pocket, and when it's not working, I hear about it. So I do feel that it's somewhat reliable data here. As you can see, of the 27 seizure-free patients, remember, these are children who were told there is nothing else, we have nothing to offer you. Here's 27 families that now have a child that's seizure-free. 8 are actually pharmaceutical-free as well. The rest are still weaning. About 40% of my patients have been able to wean one or more medicines. Sometimes it's only 5 milligrams of a drug. Sometimes it's 50% of the medication. The weaning of drugs takes a long time for many of these patients. They remember you can be seizure-free, and then if you start messing with some of the AEDs, what happens is then you start having seizures. So many of the families have actually chosen just to stay right where they're at, leave the drugs on board, and let their child outgrow the dose. And because they just feel that they're in a good place and they're terrified to lose the effect. In terms of negative side effects, the only 2 really that popped up in this were drowsiness and diarrhea. The numbers are small. Of course, the drowsiness may come from if we're using very high doses, or also I find certain medications like clobazam and others increase the sedative effect. And then if you look at the positive side effects, this is where parents on the survey really just kind of went nuts writing things. More alert, better mood, better sleep, more energy, better response to therapy, and as you can see, and I put in quotes, able to argue. One parent actually complained to me that their child wasn't as compliant because he was less drugged up and more with the program, and now he cared if you put his shoes on and gave you a hard time about putting his shoes on when they left the house. So to me, that's called a normal child, and parenting is part of that. No ER visits, less need for rescue medication. Some of my families actually measure, they used to use rectal Valium 6 times a month, and now they've only used it once in the last 2 months. So to them, they can see that that's their objective, because sometimes it's hard to count seizures or clusters. And then I have 2 patients that also have type 1 diabetes, who also the parents reported that it appeared that the glucose became more stable after. And, that's unclear if it's a metabolic issue or if the child's not seizing so much that you have better control of the glucose. In my experience, each and every patient is an individual and will respond. Everybody says, what dose, what dose? There is no one dose for every patient. It is just like everything in medicine, it needs to be personalized. I usually start at about a half a milligram per pound or 1 milligram per kilo per day. Every 8 hours. I do find that in the beginning, every 8 hours works better. Some patients are able to go to every 12 hours if they've been successful and they've been on the oil for quite some time. And then I just increase slowly every couple of weeks. I stay in close contact with the patients so that we can titrate up and find the dose. Again, because it's expensive oil, I don't want to leave them on a subtherapeutic dose for 3 months and then check on them then. It doesn't make any sense to me to do that. We just kind of start going up. And the average dose, as you can see, is between 5 and 8. I have a lot of patients under that do well. Some patients are over that are doing well. But on average, I would say the majority of patients fall between that range. In California, because there's many different preparations, if it's not working, you can change strains, you can change ratios. I have not found patients, once they find their dose that seems to work, they don't develop tolerance to it. It appears that they're able to stay at that dose. However, this interesting phenomenon has come up, and somebody asked a question of Dr. Mechoulam yesterday. This terminology called CBD saturation has come up. And it appears that for some of the patients, if they've been on the oil for quite some time, if the child starts having more seizures out of the blue, they've been doing well, all of a sudden they start having seizures. They're not sick. They haven't weaned medication. It doesn't appear to be anything else. Sometimes, somebody came up with this term CBD saturation, but really the idea is that you maybe don't need so much, and we've been able to actually back down on dose. And what's happening is that the children respond to that. I've lowered dose in at least 25 patients, and everybody says, oh no, you're going to lower the dose, what's going to happen? But they actually do well, and they stop having the clusters of seizures that kind of came out of the blue. Another thing we're using in California is THCA, which is a non-psychoactive raw form of cannabis. It wasn't really readily available until about maybe 1 or 1.5 years ago. I've seen a fair amount of patients get seizure reduction, especially for drop seizures. And just to mention, cost in California is an issue. This is out of pocket, and the medication can be expensive, especially if it's based on weight and you have a large-sized child, teenager or so, it can get very expensive. Now, John covered autism, so I'm not going to go over that too much, but I will tell you that I'm getting some very good results. There is one human study showing that children with autism have increased cannabinoid receptors, and the question is what does that mean, and how do we translate that? But it appears that there is some dysfunction in the endocannabinoid system. I have probably 70 plus autistic patients in my practice. I, again, did a survey, and I had 27 patients, parents who responded, children between the ages of 3 and 18. I did have some patients with CBD. They were overstimulated. They just became more aggressive, more agitated. Sleep was disrupted. A handful of patients, it didn't work. And about 17 out of these 27, the parents did report some improvement with calmer behavior, and really the big thing was reduced aggression, and that's very important, as John spoke about. And for many of my patients, the self-injurious behavior is very difficult. I've had patients come in with pillows wrapped around, helmets, mouth guards, all kinds of things. And if we can get that reduced, it would just mean such incredible quality of life improvement. I do find that these patients don't need very high doses. You can do anywhere from 1 to 3 times a day dosing. I listed the popular strains there, and again, high CBD can be stimulating. Some of these patients really respond very well to combination CBD, THC, and different ratios, 10 to 1, 5 to 1, 1 to 1. And so what I often do is have a separate bottle of CBD and a separate bottle of THC, and it allows the parents to personalize the medicine for that child. For pediatric cancer, as you can see, I've listed here, a lot of the side effects. I look at cancer in 2 ways. One is you're treating symptoms associated with the cancer itself or the treatment. And then also I have some patients that come to me who have exhausted every option. They've read on the internet that cannabis may fight cancer. And so, again, because cannabis has been available in California now 20 years as a medical approval, many of these patients are accessing high-dose oil, and I'm sure somebody today is going to talk about this a little bit more. But what's interesting about this is that I've actually seen some really very good results. And on this slide, I talk about, I refer you to this one particular case report that was published in 2013 of this cannabis extract for use in a 14-year-old who had a terminal acute lymphoblastic leukemia with terrible genetics. She, after 4 years, was sent home without any treatment. And this was in Canada, and the parents obtained some cannabis oil untested. They had no idea what they were giving her, but the doctors were able to follow her blood work. And remember, with leukemia, you can draw blood and you can follow the leukemia cells in the bloodstream, and they basically did it every 3 to 5 days. And when they started, and if you go to the slide or the study, you'll see that as the leukemia cells dropped as the oil went up, and it was a clear-cut dose-response curve. And this is just, a case report, but it did clearly show 2 things. One, she wasn't on any other medication, and because of her severe illness, they cannot attribute this to spontaneous regression. So it was clear-cut that the cannabis oil was doing something for this patient. I have a case report of a 16-year-old who came to me a year ago, April, with a stage 4 osteosarcoma, metastatic to lungs, to lots of different areas of bone. And they came in, referred in by an oncologist, so bravo to her for sending the patient to me. And we started very low dose CBD THC, and we went very high. We have no clinical trials. I have no idea about dosing. I don't want to underdose, and cannabis is fairly well tolerated, and the parents were willing to kind of push the dosing. And he started cannabis oil in April 2015, and in July 2015, he had PET scan, CT, MRI, and a bone scan, all negative for disease, which is really incredible. He had repeat scans in November, which were negative. I called his oncologist, and I said, "What do you think?" And she said, "Well, he should be dead." And I just saw him last week. His hair's growing back. He's off chemo. He's a little bit beat up from his 3 years of chemotherapy, but he's back in school, and he's doing really well. He was on gemcitabine, and I just put the study on here. For about the first 8 months of his treatment, he was on gemcitabine, which is, in one study, synergistic with cannabinoids to increase cancer killing. So, I am flying blind a little bit in a lot of these patients, but it appears so far that we're getting some good results. I never say cure with cancer because I don't know, but I definitely say extension of life. And then I've been given the sign to get off the stage here, so I'm just going to real quick just say cannabis treatment of pediatric psychiatric disorders. These are usually very severe cases that come to me. This is not just simple, my kid has anxiety. And usually patients have tried multiple things, and it's pretty much the same. You start low dose. I prefer to start high CBD to low THC because, again, developing brain, and we just kind of titrate up, and if we have to, we add very tiny amounts of THC just to play with it a little bit and see what's tolerated, and I've seen some very good results. PANDAS, if you're not familiar, is something that is still probably underdiagnosed. Pediatric autoimmune neuropsychiatric disorder associated with strep infection. So what happens in some patients is they get this strep infection that basically causes a dysfunction in the immune system that creates a psychiatric condition. And parents say, "My kid went crazy," and nobody relates it back to the strep. But now we're starting to see that there's this relationship. I've had 3 cases in my practice, and I've had very good results, all responding well to CBD-rich cannabis oil. It's just an N of 3, but it's a place to start. The parents report that they feel like their child is coming back to normal. And so that's very important. For those of you who are making products for children who want to be part of the answer to this predicament we have with cannabis in our country, I've listed here the most important things that I see. Cannabis oil has to be concentrated for children. You cannot give a child 300 milligrams when it's got 4 milligrams in 1 teaspoon. How many teaspoons a day is that child going to have to take? So it has to be concentrated. Consistency and strain. If a family finds a strain that works, they don't want to go back next month and hear, "Oh, gee, you know what? We didn't grow that one anymore. We have a new one." That's not an answer for a family who has a very sick child. Laboratory tested goes without saying. Affordable. And then a reliable supply. You can't go back to your supplier and they say, "Oh, we sold out of that one. Why don't you try something else?" That's not going to work for these families. And then This is the best slide of all. These are all some of my patients. One of my patients went to Venice Beach and put cannabis glasses on her child who is seizure-free and pharmaceutical-free after 13 years of struggling with seizure disorder. Love that. This is, I just want to say, this is what keeps me going, is these kids right here. And if you ever kind of get discouraged by what's going on with the government or someone in your way, just try to focus on these families and continue to move forward. Thank you.